Child's Eye Foundation came into contact with Smile Africa through one of their donors who had actually referred a case to Child's Eye Foundation and learned about the work that we do with children. She eventually put us into contact with the director and founder of Smile Africa Ministries in Tororo, who at that same time was going through a journey of learning. So we started engagements with the director and founder of Smile Africa Ministries through trainings, telling them about the work that we do, sharing with them literature about children growing up in families, our own experience as an organization, because we also started as a children's home. We used to take children in. We signed an MOU with Smile African Ministries in August 2016. And 3 months later, after engaging the government, we were able to sign an MOU with Tororo District's local government in November 2016.
While working with Smile Africa, we started with the grassroots. We involved the local community. We also involved the local government. We did trainings to enhance and elaborate more about the institutionalization. We also empowered the probation officer. We provided internet services to enable her work with us. We also piloted the alternative care panel. Basically, this was to find alternative families for children who we had failed to find their biological family, so that they are also placed in a family setting. We also had support from the churches. This helped us basically in recruitment of foster parents. We also involved community volunteers. These were trained about family-based care. They were sensitized about the traumas children go through while in institutions. Basically, this was to enable them support the families while the children are back in a community setting.
We wanted to pioneer the closure of orphanages at district level. So that meant engaging all the childcare institutions in Tororo. We gave them all the information that we had. We trained them on child protection so that we walked this journey with them, so it wasn't an isolated journey. So even for those institutions that we did not sign MOUs with, we gave them the knowledge and capacity to be able to realize that children are actually better in families. We gave them the evidence for this. So some of them on their own actually started resettling children back home, even without our direct input.
Initially, we had some children having family breakages. Basically, would look at foster care. Usually, when some foster care placements have not gone well, I would have some children brought back to the institution. But this, since we had created a foster care system in place, we had emergency foster carers. So we did not want children placed back in an institution. So we would ensure that children are placed in emergency foster care while we find another permanent solution to ensure that the child is placed back in a family setting.
Stakeholders we worked with on this journey, the first stakeholder is definitely the government. We had to have government support because the work that we're implementing is basically on behalf of the government. So we had to have government will and support, most specifically working with the probation and social welfare officer who is in charge of children and family issues within a district. We had Smile Africa Ministries come on board to work with us. We had local NGOs come on board to work with us. We had Plan International, we had World Vision, we had other small community-based organizations. We had Mifumi within Tororo. So all these stakeholders were involved. We had trainings where we would invite all these stakeholders. We would talk about our journey, the project, the implementation, what we wanted to achieve, the child protection mechanisms we wanted to build on. We also asked them about the existing child protection mechanisms within the district. So we did not create anything parallel to what was already existing, but building on to what was already in the districts.
The partnership between Child's Eye Foundation together with Toro Local District Government and Smile Africa Ministries resulted into child care reform. As of date, we don't have any institutions within the district, and this enabled the community to embrace foster care systems. The community now is able to understand that a child does not necessarily have to grow up in an institution. As a community, it's all our responsibility to ensure that our child grows up in a family setting.